Have you ever caught yourself glancing at your nails and wondering if they hold a secret message about your inner well-being? Our nails do so much more than just protect our fingertips or enhance our style. They can serve as windows into our overall health, revealing subtle hints about what might be happening inside our bodies. Today, we're taking a deep, engaging dive into the hidden clues your nails might be offering. From shifts in color and texture to changes in shape and growth patterns, each detail can be a signal from your body that deserves attention. Before we embark on this enlightening journey together, please take a moment to like, subscribe, and share this video with your loved ones. Imagine your nails as a natural health diary, recording information about your body's internal state over time. When you notice subtle changes, they might be telling you something important about your health that you can't ignore. Let's explore some of these fascinating signals and understand what they might mean for you. Let's start with nail clubbing. This condition is characterized by the soft tissue at your fingertips becoming enlarged and the nails curving gracefully around them. This isn't merely an aesthetic change. It could be your body's way of signaling that it isn't receiving enough oxygen. When oxygen levels in the blood drop over a prolonged period, it can impact various systems in your body, including the lungs, heart, and even the digestive system. Chronic respiratory conditions, such as long-term inflammation in the lungs or more serious illnesses, might lead to these changes. In some cases, congenital heart issues or bacterial infections affecting the heart can also result in clubbed nails. Even certain gastrointestinal disorders have been associated with these alterations. If you begin to notice that your fingertips are rounding out or that the nails seem to embrace your fingertips more than usual, it may be time to consult a healthcare professional who can evaluate your oxygen levels and overall health. Next, let's talk about a condition known as Onycholysis or spoon-shaped nails. In this situation, your nails become thin, soft, and develop a distinct concave shape that resembles a spoon. While this might sound like a minor cosmetic detail at first glance, spoon nails can sometimes be an important indicator of underlying nutritional issues, particularly iron deficiency. Iron plays a crucial role in many bodily processes, and when its levels drop too low, it can affect the formation and strength of your nails. In some cases, a genetic predisposition leading to excessive iron absorption might also be involved. Additionally, circulation issues such as those seen in conditions that affect blood flow can contribute to this appearance. Noticing a change in the shape of your nails should be a signal to check in with your doctor, who can run simple tests to determine if your iron levels or overall nutrient intake need attention. Another interesting signal your nails might send is the appearance of horizontal grooves or indentations known as Beau's lines. These subtle depressions that run across your nail plate are like a timeline of a period when your body was under stress. When your nail growth is interrupted, whether by a severe illness, a high fever, or a significant physiological stress, these lines can appear. They serve as a reminder that at one point, your body was fighting hard to overcome a challenge. For some, these lines appear after recovering from an infection or a bout of high fever, while for others, they might be linked to chronic conditions like uncontrolled diabetes or circulatory issues. Recognizing these grooves and reflecting on your recent health history can be a useful step in understanding whether your body needs extra care or medical evaluation. Now, consider the intriguing case of Muir's lines, paired white bands that run parallel to the base of your nails, right near the crescent-shaped lunula. Unlike other marks that move as your nails grow, these lines remain stationary, hinting at an issue that is systemic rather than local. One common connection is with low levels of albumin, a vital protein in your blood. Albumin is essential for maintaining fluid balance and transporting various substances throughout your body. Conditions like liver disease or poor nutrition can lead to decreased albumin levels, and these white bands might appear as a subtle signal of that deficiency. If you notice these persistent, unchanging bands, it could be a sign to look more closely at your nutritional intake and liver function. Addressing these underlying issues can sometimes improve both your overall health and the appearance of your nails. Moving further along our journey into nail health, we come across yellow nail syndrome. When your nails begin to take on a thickened, yellowish hue and seem to grow more slowly, they might be communicating something more significant than just a change in color. This condition has been linked with respiratory issues, such as chronic bronchitis, as well as problems with the lymphatic system, where fluid drainage isn't working as it should. In rare instances, yellow nails can even hint at the presence of tumors or other serious health concerns pressing on internal structures. The key takeaway here is that a noticeable, lasting change in nail color or texture is a prompt to seek professional advice. Don't dismiss it as merely an aesthetic concern. Your nails might be trying to tell you something crucial about your health. Another fascinating change to be aware of is the appearance of Terry's nails. These nails often present with a distinctive, milky white look, almost as if covered with a fine layer of ground glass. There might also be a subtle reddish-brown band near the tip of the nail, which adds to the overall change in appearance. Terry's nails can be an early warning sign of systemic issues affecting the liver, such as cirrhosis, or problems related to heart function, such as congestive heart failure. In some individuals, chronic conditions like diabetes can also bring about these nail changes. Recognizing this pattern early can provide you with a critical opportunity to undergo further testing and obtain a clear picture of your overall health, allowing for timely intervention and management of any underlying conditions. Another subtle clue comes in the form of splinter hemorrhages. These are tiny, reddish-brown streaks that appear under the nail, resembling small splinters embedded beneath the surface. While occasional splinter-like marks may occur from minor trauma or pressure on the nail, persistent or multiple occurrences can be more concerning. They might indicate an infection affecting the heart or even a form of blood vessel inflammation known as vasculitis. When your nails repeatedly display these small streaks, it's worth paying closer attention, as they might suggest that your body is fighting off an infection or that there is an issue with your circulatory system. In such cases, a consultation with a healthcare provider can help pinpoint the cause and determine the appropriate steps for treatment. Let's also explore onycholysis, a condition in which the nail begins to lift away from the nail bed. This separation can start at the tip of the nail and extend toward the cuticle, leaving a gap where the nail no longer adheres properly to the underlying skin. Although onycholysis might not always cause pain, it can be a sign of various underlying issues. Fungal infections are a common culprit, particularly in environments where moisture is prevalent. However, onycholysis may also be linked to systemic conditions such as thyroid disorders, particularly an overactive thyroid. When you notice your nails gradually lifting, it's a signal that your body may be under stress or experiencing an imbalance, and taking steps to address the root cause is important for both your nail health and overall well-being. Nail pitting is another intriguing phenomenon that warrants our attention. This condition is characterized by small depressions or dimples scattered across the surface of the nail. Often, these pits are associated with inflammatory skin conditions, most notably psoriasis. Psoriasis, being an autoimmune condition, can affect more than just the skin. It frequently leaves its mark on the nails as well. Additionally, other conditions such as alopecia areata, which primarily causes hair loss, or chronic eczema, can lead to similar pitting patterns. Observing these tiny dents in your nails may prompt you to consider whether there is an underlying skin condition that needs to be addressed, and seeking advice from a dermatologist can help you manage both the appearance and the root cause of these changes. White spots or streaks on the nails, often known as Leukonychia, are another common observation. In many cases, these white marks are harmless and result from minor trauma to the nail bed, perhaps from a bump or pressure that interrupted nail formation. However, if these spots appear frequently or in unusual patterns, they might indicate something more systemic. For example, when paired with other nail changes, they could signal a nutritional deficiency or an underlying health condition that affects the body's ability to properly form nails. Keeping an eye on these changes can be an important part of your overall health monitoring routine, as even small variations might be the first sign of something that needs attention. Beyond these specific conditions, it's essential to recognize that your nails can serve as a reflection of your lifestyle and overall well-being. Factors such as diet, hydration, stress levels, and exposure to environmental toxins can all leave their mark on your nails. A well-balanced diet rich in vitamins, minerals, and antioxidants not only supports your internal health, but also contributes to the strength and appearance of your nails. Hydration is equally critical. Ensuring that your body gets enough water helps maintain nail flexibility and prevents brittleness. Regular physical activity, sufficient sleep, and effective stress management further enhance your body's ability to maintain healthy nails and, by extension, overall health. As we explore the diverse signals that your nails can send, it's important to remember that these changes are not always a cause for immediate alarm. Instead, they serve as early indicators, giving you a valuable opportunity to catch potential issues before they develop into more serious conditions. By paying close attention to the subtle messages conveyed by your nails, you can make proactive choices to support your health. Whether it means adjusting your diet, taking better care of your skin, or seeking timely medical advice, every small step contributes to a healthier future. At this point in our discussion, I encourage you once again to like, subscribe, and share this video. Your engagement helps us continue to deliver high-quality, informative content, and it allows you to be part of a community dedicated to proactive health management. By staying connected with the Public Health Room, you're not only learning about the latest in health insights, but also empowering yourself to take control of your well-being. As we near the conclusion of our deep dive into the messages your nails might be conveying, let's take a moment to reflect on the broader significance of what we've learned. Our nails are not just ornamental. They are a dynamic record of our body's internal health, a canvas that tells a story about our nutritional status, circulatory health, and even the presence of chronic conditions. Each subtle change, from a slight curve to a faint discoloration, is a potential clue that can guide you toward a healthier lifestyle. It's a reminder that every detail matters, and that listening to these signs can lead to early detection and intervention. Remember that while the information we've shared today can be incredibly insightful, it's always best to consult with a healthcare professional if you notice any significant or persistent changes in your nails. Professional guidance is essential in accurately diagnosing any underlying issues and determining the most effective course of action for your health. Your nails are a starting point, a visible cue that prompts you to look deeper into your overall health and well-being. Before we wrap up, I'd like to thank you for joining me on this comprehensive exploration of nail health. Your willingness to pay attention to these small yet significant signals is a testament to your commitment to living a healthier, more informed life. Don't forget to like, subscribe, and share this video once again, so that together we can build a community that values proactive health and the pursuit of knowledge.